Welcome to The Explainer. Today, we are getting right into a topic that comes up at the pharmacy counter every single day, nutritional supplements. We're going to break down the clinical evidence into a really practical guide you can actually use with your patients. All right, so here's how we're going to tackle this. We'll kick things off with the big picture, the balancing act. Then we'll get into who actually needs these things, look at some major drug interactions you need to know, cut through the hype versus the real science, and wrap it all up with a super useful counseling checklist. Okay. First things first, the number one concept we're always dealing with when it comes to supplements is this balancing act. You know, it's all about trying to find that sweet spot for our patients, right between not having enough and having way too much. And this is really the core question we have to ask for every single supplement, right? Is it an essential nutrient or is it a potential harm? Because while they're absolutely vital for our bodies, that common patient idea that, hey, if some is good, more must be better, well, that can be flat out dangerous. We now know that too much of a good thing can lead to some serious toxicity, sometimes at doses people used to think were perfectly fine. So this slide really frames our whole discussion. It's super simple, but it's powerful. On one side, you've got deficiency, which can cause illness. And on the other side, you've got toxicity from taking too much. Our job as clinicians is to keep our patients right in that safe zone, in the middle. We want to avoid both of those extremes. All right, so that brings up the big question. Who really needs to be taking supplements? I mean, for the average healthy person who eats a pretty balanced diet, it's usually not a huge issue. What we're really looking for are those specific patient populations, the clinical exceptions where our advice is crucial. And the evidence is pretty clear on who these groups are. Our clinical antennas should really go up when we're talking to patients who are pregnant or breastfeeding, people on exclusion diets, think vegans or vegetarians, or those with conditions that mess with nutrient absorption, like after bariatric surgery or with IBD. And of course, the at-risk elderly are a huge one too, especially with polypharmacy and often poor diets. Let's take a look at a really critical example where our guidance isn't just helpful, it's life-changing. I'm talking about folic acid in pregnancy. This is not a one-size-fits-all situation. Just giving a standard recommendation isn't good enough. We have to tailor our counseling based on that individual patient's risk. And this table just lays it out so clearly. Look at this. For a low-risk patient, yeah, 0.4 milligrams a day is the standard. But for a high-risk patient, maybe someone with a personal history of a neural tube defect in a previous pregnancy, that dose jumps up 10 times to 4 milligrams a day, and they need to start it months before even trying to conceive. That right there is a clinical intervention that can literally change a family's life. Okay, let's shift gears and talk about something that is right in our wheelhouse as pharmacists. I'm talking about drug-supplement interactions. Honestly, this is where we can provide so much value. And you know, it's not just about the supplement messing with a drug. It goes both ways, and this is so common. A lot of chronic medications, drugs our patients are on for years, can actually deplete essential nutrients. So recommending a supplement becomes a key part of their therapy. This table is basically a greatest hits of drug-induced nutrient depletions. I mean, we see this stuff every single day, right? Any patient on a long-term PPI or metformin, you should immediately be thinking about B12. Someone on chronic steroids or certain anti-epileptics, vitamin D should be on your radar. These are slam-dunk opportunities for us to step in and provide proactive care. And just to put a number on it, this isn't some rare, oh, it could happen thing. Take metformin. Up to 30% of patients taking it can have problems absorbing vitamin B12. That's a huge number. This is a common, predictable issue that we are in the perfect spot to catch and manage. All right, now for the big one. Let's talk about what our patients are seeing on social media and hearing from, well, everyone. This idea that you can just pop a bunch of vitamins to prevent huge diseases like cancer or heart disease. This is where we have to be the voice of reason, because the actual clinical evidence tells a much different story. And sometimes it's a dangerous one. I mean, vitamin E is the classic example. The theory was great, right? It's an antioxidant, so it should prevent cancer. Makes sense. But when they actually studied it in the big SELECT trial, what happened? The exact opposite. Vitamin E supplementation was shown to increase the risk of prostate cancer by 17%. A huge reversal. And it's not the only one. Here's another really important counseling point. Beta-carotene. People think it's just a safe antioxidant from carrots. But it's not harmless for everyone. For certain high-risk people, we're talking smokers and those with asbestos exposure, taking beta-carotene supplements actually increased their risk of lung cancer. That's not just a lack of benefit, that is clear-cut harm. Okay, so what about heart disease? This is a huge one. Patients come in all the time asking if they should take vitamin C or D or a multivitamin or even omega-3s to prevent a heart attack. And the evidence from massive, well-done trials like the Physicians' Health Study 2 or the VITAL trial is just really clear. For primary prevention in healthy people, they just don't work. Okay, so we've covered a lot of ground. Let's bring it all home and put it into a simple, practical checklist you can actually use during a busy day at the pharmacy. Something to make your counseling quick, effective, and most importantly, based on good evidence. So just think of these 5 goals every time someone asks about a supplement. It's like a mental checklist. Number 1, is there a real identified deficiency or need? 2, is the dose right for this person? 3, how do we prevent them from taking too much? 4, what drugs are they on? Let's check for interactions. And finally, number 5, does the potential benefit actually outweigh the risk for this patient right here, right now? And you know, the foundation of this entire conversation, our most powerful tool, is always bringing it back to diet. We have to constantly remind our patients whole foods first. Supplements are just that. They supplement. They can never, ever replace a healthy diet. I mean, it's right there in the name. The definition says it all. Their job is to supplement the diet, not to be a substitute for it. They're meant to fill in a specific gap, not to build the whole foundation. Good nutrition from food is always the foundation. So what does this all mean for us? It means the next time a patient walks up to your counter with a bottle of supplements, it's more than just a transaction. It's a real opportunity. It's a chance to open up a conversation about their health, to check their meds for potential problems, and to give them that personalized, evidence-based advice that really makes a difference. It's how we turn a simple question into better patient care.